From black market Botox to the rise of medical tourism, cosmetic procedures can have dangerous consequences if you don't know what to avoid.
Yeah, and board-certified plastic surgeon Dr. Anthony Youn joins us now to break down what you need to know about staying safe when opting to go under the knife. Welcome, Dr. Youn. It feels like we've been separated. We got the doctors over there, but we've seen the headlines of all of these people ending up with really awful things after these cosmetic procedures. Is this something that's becoming more common now?
Unfortunately, it is, and it's two main reasons. Plastic surgery is very expensive, and so there are a lot of people who just can't afford it, especially with inflation nowadays. But you combine that with social media, and social media has made the world so much smaller and has really given doctors who may not be the best doctors access to potential patients, and they may not be telling the truth. You know, I've actually seen before and after photos of the same patient on different doctors' profiles. And these are doctors who aren't in the same practice together. Wow. So there's a lot of dishonesty, unfortunately, in social media and in plastic surgery.
Okay, so if you're looking for a plastic surgeon, what are the things to look for? What are the things to avoid?
So the number one thing is you want to find a plastic surgeon who's actually certified by the American Board of Plastic Surgery or the American Board of Facial Plastic Surgery. That way you know that they're actually a real plastic surgeon and that they underwent training in plastic surgery. It's not sufficient just to say that you're board certified. And if a doctor's saying, oh, I'm board certified, the question is, what are you board certified in? Are you board certified in family medicine? In which case, maybe that's not the best person to do your plastic surgery. And then the final thing you want to consider is when you do a consultation with a doctor, make sure that that doctor is not trying to convince you to do operations that you didn't come in for. So if you say, hey, I'm thinking about doing my upper eyelids, and they're trying to convince you, oh, you should get your nose done, you should get a facelift, you should get breast implants and a tummy tuck, then you got to consider that maybe they don't have your best interests in mind.
That's great advice.
Yeah, absolutely. And Dr. Darian, I think you had a question also about...
Yeah, no, I just wanted to add to his point, though. Our board certifications are also public, and so when you're searching for that, that is public knowledge and public information. As Dr. Youn was saying, I'm an emergency physician. I'm board certified in emergency medicine. Only one of us should be using this Botox to touch your face, and so you want to make sure that, even theoretically, both of us could. You want to make sure that the right person is doing it.
There's no law preventing any doctor from performing any procedure that they want to, as long as the patient signs on the bottom line.
And many people aren't aware of that.
You were talking about how plastic surgery is so expensive. So is there a way to save money? Is there a way to get a deal?
Yeah, so there are two kind of pseudo-cosmetic surgeries that your insurance may actually pay for. If you've got a lot of excess skin of your upper eyelids, then an upper blepharoplasty can often be paid for by your insurance if you have issues with your visual fields. Breast reduction surgery, it's pseudo-cosmetic. Obviously, if you've got breasts that are so large, you've got back, neck, and shoulder pain, insurance may cover that. And the other thing to consider, if you are considering just true cosmetic surgery, and you can't afford a real board certified plastic surgeon, there are dozens of plastic surgery residency programs across the country. There are resident clinics there where they perform cosmetic surgery at major discounts, but keep in mind that they are overseen by real board certified plastic surgeons. So you may have a resident performing your surgery, but there's always a board certified plastic surgeon who's overseeing that resident. It's a way to save money, stay in the United States, and have it done at a reputable institution.
And Botox, we know this, it's less invasive than surgery, but there's still things you got to keep in mind, right, for safety?
Yeah, definitely. So when you're having a Botox treatment done, there's certain things that should be done. So the first thing is, if you want, you can apply a topical anesthetic, like we have a topical one right here. That's optional. If you want to go without it, I get my Botox done without topical, that's okay. And then you want to make sure that your injector puts on a pair of gloves, takes some alcohol, wipes the area off. And then you want to make sure that you look at the actual Botox. There is black market Botox out there. So make sure that there's a hologram that's actually on the vial, and there's an actual seal on top of the Botox box to make sure that it's real Botox and not something that's fake. And then at that point, your injector will inject you. It's not that painful. You put a little pressure over the area. Some people say it's easier than getting your teeth cleaned at the dentist.
And it's okay to ask. It's okay before you're getting anything done to yourself or injected. It is okay to ask, to see what it looks like, to inspect it. That is your body, and it should be respected.
I have to ask you, because we have to talk more about the Botox of it all, because so many people are doing Botox now, both getting it done and injecting other people. Who should you be going to for a procedure like this?
So each state has its own requirements, but in general, there are nurses, there are plastic surgeons, there are physicians that will do it. You also want to ask, whenever you have an actual plastic surgery procedure, you want to ask that doctor how many of you had done. Okay, so whether it's Botox or actual surgery, it's even more important. How many of you had done? The more you've done of a certain procedure, the better in general the outcomes, and studies will show that. Second thing you want to ask is where do you have hospital privileges to perform this operation? So if you are going to have, let's say, a tummy tuck, you want to make sure that doctor can perform that surgery at an actual hospital, because the hospitals will vet the doctors for you. And if you have a complication, like let's say you have uncontrolled bleeding, you need to know that doctor can treat you at a real hospital. If they don't have hospital privileges, then you're on your own, as scary as that may be. And then the final thing is you want to ask about scars. You know, any plastic surgery that we do will create scars. Where are those scars going to be? How long will those scars be? And how am I potentially going to heal from it?
All things that are good to keep in mind. Thank you so much. 2 doctors today. Double the knowledge. Thank you both.